Well, good evening, everyone. We still have some attendees who are joining us for our community forum tonight. So we're going to get started here in just a moment, give maybe another minute or so for those who are joining us via Zoom that want to participate that way. And also we have people who are watching on YouTube, which is great. We are glad that you're tuning in and giving us an opportunity to answer some of your questions, provide some updates, let you know what we are doing as community leaders to try to address all things related to this current situation that we've been in for the last couple of months. And so I'm very pleased to have Dr. Raywalt with us tonight, our Director of Health and Human Services, Heather Snow, Supervisor, Chair of the Board of Supervisors, Jerry Hemmingson, Police Chief Richard Griffin is with us. And just thank them for being with us tonight. And I think that we've given time for our attendees to get on Zoom. So we're going to go ahead and begin. I've asked Police Chief Griffin to give us a kind of an opening comment. I know that many of you have been concerned about the things that we have seen across our nation in the last week or so. And I'd like Chief Griffin, as our Chief of Police, to maybe make a statement that I feel that would be good for our community to hear. So, Chief.
Thank you, Mr. Mayor. May 25th was a day I won't forget for a long, long time at all, if I ever do. George Floyd's death was avoidable. There was no need for it. Definitely could have been a lot of things done differently in those 8 minutes and 46 seconds. In speaking with Sheriff Apperson today, we wanted to make very clear points to everyone in this county and the city. We do support your First Amendment rights of protest. Definitely engage in it. It's a fundamental American right. We are there supportive of it anytime. We also want to make it very clear that we're not supportive of the violence that's come with it. I think they're two separate issues by far. I think the protesters are out there doing the right thing, and there's some groups behind it that are trying to take this time to create more divide than is needed. We need a lot of talk right now. You know, it's not time for debate, it's time for moving forward. We know what the problem is, we can address it. But just wanted to make that clear and show our support of those people. We've already had one protest here in the county, went very well, had one minor incident. That was it. It's what I expected of our residents by far. So also just to make clear, we have already been on the progressive side of making sure that our officers are held accountable here at the Crescent City Police Department. I know what Sheriff Apperson also does with his in training. All my officers today, as of today, have completed a de-escalation training. It's post-mandated, or it's on the post website we've done. We're going to continue doing that and shaping every day of what we do. I've made it no secret why I do my job. It's very simple, so I can raise my kids in a good place and raise them to be good human beings. And if we can all just do that every single day, I think it's going to be a better place. So I'm very hopeful for a significant change through this. And we do support you, the protesters, non-protesters. We just want it to be peaceful.
You're on mute, Blake. You've been on mute.
You'd think after 2 months of this, you'd remember, right? But so thank you, Chief.
Before too, several times.
Appreciate you taking the time and joining us tonight and sharing your thoughts. I'm going to turn it over to Heather Snow, Director of Health and Human Services, going to give us an update about what her departments have been doing and kind of give the public an idea of all the hard work that's going on that we may not see every day. So Heather, thanks for being here. Talk to us a little bit about what's going on.
Sure. Thank you, Mayor. For anyone who doesn't know me, I'm the Director of County Health and Human Services, which does include public health. I'm a clinical social worker by trade, and so of course, Dr. Raywalt will be covering all of your medical questions tonight, but I do have some public health items that I want to share with our community. As we've seen the number of positive tests and pending tests jump recently, I've definitely felt some understandable anxiety and fear in the community. And I really want you to know that you're in good hands. And I want to share some of the behind the scenes work that's being done pretty much around the clock at this point. Not all of you have what I would consider the great pleasure of knowing our public health team personally like I do. So I want to share that they are some of the most truly compassionate, reliable, and conscientious people that I know. Our public health nursing team is surprisingly small. We went into coronavirus with 3 nurses, and we've been fortunate enough to pick up a 4th recently, and this was a huge success for us. We've also onboarded 24 county employees recently to do disaster service work as contact tracers. And we're going to be working with Open Door Clinic to get some of their staff trained to do case investigation and tracing for their patients as well. So normally our public health team is primarily focused on prevention activities, but right now management of the pandemic has been just a completely 24/7 job that has taken over everything. The team is giving their weekends and even their holiday weekends and these things that you really don't think of typically a prevention staff having to do. It's what the world has become right now for us. So something that's going to be a huge help for us is the state contact tracing platform. We began piloting this yesterday, and it's really going to help us respond to positive cases and close contacts in a faster, more standardized way. It's going to improve our ability to monitor and support contacts, and then it's going to help us track our response to the pandemic. We do have some preliminary approximated quality assurance information that I will share with you, and I hope that it will help you feel confident about the work that our team is doing. So for positive tests, public health has made direct contact with all individuals who were diagnosed positive within 12 hours of the positive test confirmation. We also contacted approximately 300 people over the last 2.5 weeks when we experienced our recent surge to let people know that they could have been exposed to a person who tested positive, and really to talk them through that to determine how high or low their exposure was, if they were in fact exposed. And we believe that in most cases, we were able to do this within 24 hours of becoming aware of the possible contact, which has undoubtedly played an essential role in preventing further spread. And this is really a testament to the tremendous response that we've had to the crisis. And so I feel very proud of the way our team has stepped up during this time. Now, even though we've gone through our own small but significant spike in cases recently, what I would call a silver lining is that none of the cases required hospitalization. Many of them are now recovered, and for the past 2 days, we have not had any new positive cases. So that's good news. And I also want to share some information about how we're addressing the needs of people who are experiencing homelessness during the pandemic. This is always a concern of ours, and it's certainly an even higher priority right now when there's higher risk. So we're participating in a state initiative. It's called Project Roomkey, and we're contracting with local hotels to provide non-congregate shelter for anyone who's homeless. As of yesterday, Project Roomkey had served 21 adults and 4 children. That included 4 families. We're also working closely with Del Norte Mission Possible, and we've supported them to provide porta potties, portable hand washing stations, and hand sanitizer for this population. Another important service that's being offered by Mission Possible that you may have heard about, because there are very many heartwarming success stories from this initiative, are the temporary showers for the community. Mission Possible is overseeing this with support from the county, the city, and Wild Rivers Community Foundation. And Mission Possible is also working with the Office of Emergency Services to get their PPE needs addressed. So that includes masks for the homeless. And these are all some really great things that I wanted to put out there for you guys so that you're aware of them. Thank you for giving me the chance.
Thank you, Heather. Really appreciate you giving an update and letting us letting the community know about all the work that's being done. And unfortunately, sometimes we don't see all of that, especially while we're sheltering in place. But I appreciate very much you, your team, all the work that's going on day in and day out to provide for our community. So good work, and be sure you pass that on to all of your team as well, how much they are appreciated by those of us who are trying to lead our way through this. So thank you. And thanks for being here tonight. I really appreciate it.
Thank you. My pleasure.
All right. Mr. Hemmingson, Chair, why don't you give us some words of perspective as you see where we are in this situation right now?
Sure, I'd be happy to. I could share a success story with you right off the bat. As you can see, I was able to get a haircut. And since it had been growing for about 3 months, I asked them to take an extra month off. So I got a 4-month haircut. So I got plenty of it taken off, and because you never know what the future is going to bring, it may be a while before I get another haircut. I do have some information to pass along. I'd like to get that out of the way if I could. There's new information on a site that I'll give you so that you can get the data on cases and all the information that is available. The new site is at www.co.del-norte.ca.us, and then just click on the COVID-19 local statistics link, and you'll the data on the site pulls directly from a data management system now being used by the Public Health Department. Public Health is continuing to work with OES and information technology to improve the site, and in the coming weeks we'll add more data and graphical enhancement to help better understand the data. Additionally, we will start migrating COVID-19 related information contained on a variety of public health, OES, and other county sites to this one location for easier access. Another feature we plan to offer next week is a subscription service where anyone can register their email address to receive the COVID-19 related information, statistics, press releases, and general information. Like I said, we're working on that. So everything is good. I do want to share a few things. I'm getting a lot of, I don't want to come complaints, but a lot of people that are concerned, business owners who are concerned that we're not opening fast enough, and other community people that think we're opening too fast. I don't know what the answer is. Hopefully this is all science driven and that we don't get too political into the weeds. This is not an order that the county has put out. This is an order by the governor. This is a national pandemic executive order. All of these things are put in place, and fortunately or unfortunately, Dr. Ray Walt gets the job of trying to figure out everything that he's supposed to do or not do. I know that's a tough task, and I think he's done a great job, as well as I want to put in, kudos to Heather and her staff. Just like the mayor was saying, they are doing so much with so few that it is absolutely amazing, and they are doing a great job. And none of them or any of these people should be criticized for doing their job. They're only here to assist you and keep everything moving forward. And we'd like to see that continue to happen. I know there's a lot of frustration. The governor's put out a lot of stuff and then not followed up with any direction. So that makes it difficult on everyone and very frustrating for everyone. We're doing the best we can. Those people that think the county can just lift all these restrictions and say, go back to work, in my opinion, it's actually not my opinion, but we're an arm of the state. We're a general law county. We do what the legislature and the governor tells us to do. We don't have the authority, and this could be just my opinion because I'm not sure. I don't think we have the authority to lift the governor's executive order. I don't think we can just go out there and say, you guys can open up. We're not doing you any favors. Your business could be attached to some permit or licensing. That does not alleviate the risk of losing that or losing funding for the county if we were to do something like that. So, I feel for everybody out there that that has a business that relies on the tourists to come through and support their businesses. All of our businesses are that way. We make our money 3 months out of the year, and we try to make enough so that we can skate through the other 9 months. I know that that's difficult. I just don't know how to tell you that that is not an order that I think we have the authority to lift. So I just wanted to put that out there. There are some good things that are, there's some positive notes. Many businesses have had the opportunity to open up and are opening up using the protocols, the sanitizing, the social distancing, the masking, those types of things are, those are all positive things, and we're working in that direction. And with the demographics showing that the younger population is getting infected more than the older populations, us older people who are a little bit in fear of this disease and are taking it seriously, maybe are much more aware and cognizant of what's going on. So I think we're maybe being a little safer. And I know when you're 18-year-olds, you're immortal. This isn't going to affect you, and chances are it won't. And I hope it doesn't. And I hope it doesn't affect anybody anywhere or in our community. I do want to say that thing. And so I just want to reiterate to people out there that are listening to continue to wear your masks, to protect your neighbors. The masks are to protect the other person, not you. They're not going to protect you. They're going to protect the other person. So continue to do that. Continue to wash your hands frequently. Use good hygiene, and use that social distancing. Use everything to your advantage. Don't take care of your neighbors and the elder. We've done a great job of doing that. As it shows, we've had no hospitalizations. We've had no ICU stuff. We've had no deaths. So I think people, for the most part, are doing what they can do to keep us safe. And I want to applaud you all for doing that. None of us asked for this situation. I mean, we're just thrown into it, and we're dealing with it the best we can. And just continue to be respectful of others, and listen to those people that are using the information and the data to help protect you. So Blake, that's pretty much it in a nutshell. I know that we're independent in this community. We're opinionated. We're also resilient, and we're resourceful. So continue on, keep doing what we're doing. We're doing the right thing. Things are working out. We've got more testing available. As Heather said, they're tracking and tracing and working diligently to find out where these cases are so they can isolate and not infect more people. So please continue to do what we're doing. I think we're on the right track. And I'm pretty optimistic that we'll see in the next 2 weeks, maybe a relaxing of some of these restrictions and maybe get more back to normal. I think large gatherings are maybe going to be down the road a bit, but maybe we can get some of these things lifted. That's about it. I probably took plenty of time, Blake. Thanks. I know we're trying to get things moving quicker, but there were a few things I wanted to get out there.
That's all right. Thank you, Jerry. Appreciate you giving some perspective and some really good, encouraging advice about what we need to keep doing. Well, let's jump into this. Dr. Raywell, a lot of our questions had to do with reopening. And one of the things that I wanted to start with was some people's assessments that with the things that we've seen, not so much here in Delaware County, but across the state with some of these protests and gatherings and people not wearing masks, not social distancing necessarily. And so I guess the first question that I want to throw to you is the shelter in place still in effect? And should we still be applying those same standards here in Delaware County?
The short answer is yes. The shelter in place has been modified, but that doesn't mean it's been lifted. And I know this because on a lot of the state calls with the health department, state health department, we hear over and over again, their great concern is about movement of people up and down the state. And, you know, what that portends for smaller counties or for communities that think they have something under control if there are people moving in and out. That is a chance for virus to be reintroduced or to be increased. Virus activity gets increased. So yeah, the shelter in place order is still intact. It's just been modified and it's going to be further modified. And, you know, I think we're all looking forward to that. The key thing is to do it in a stepwise way and take enough time so you can really measure the impact of the last change that you made. So right now we're looking at the effect of introducing barbershops and hair salons back into the community, getting them up and running. And over the next few weeks, places of worship. All the churches have been sending in their plans and we've been reviewing them, and you know, a lot of them, they look great. I think they're going to do a good job. But still, those are kind of the situations we need to be cautious about because they are by definition high risk. If you gather together a lot of people in one place, especially a high proportion of them are elderly in a lot of congregations, that's a recipe for a problem if people aren't being careful. And same thing with the hair salons. If they do a good job and they're wearing face protection, face coverings, and doing the sanitizing, I think they can operate and do it safely. But we have to have a little time to measure this now. Now that we've made these changes, we got to sit back and just watch and wait and see what's going to happen. Because if you relax things too much and things start to change in a way that's not good, you may not realize the full effect of that for at least a month because the virus doesn't instantly change overnight. It just takes time to measure it. And that's kind of where we are right now.
So would it be safe to say then that the real reason that we don't just open everything up is because we don't want to have to turn around and have to shut everything back down?
Pretty much.
Okay.
In a nutshell, that's a good way of putting it. If you open everything all at once and too much virus activity got going and too many cases started showing up in the hospital and the hospital got full, that's the situation we are trying to avoid at all costs. And nobody wants to see what that's like. No. So yeah, we would have to shut everything down under that scenario. We'd have to go back to where we were in March. And I don't think we need to do that. I think if we're making these measures part and parcel of daily life and operating these businesses with these extra protections in place, I think we can manage this. And I think that's the feeling in public health circles all up and down the state and really throughout the country. It's just finding the right formula and taking enough time to make sure we've got that right formula.
So on the flip side of this, and there's always both sides of this in our community, one of the questions that we received was when we saw such a significant spike in cases going from 4 to 47 where we are now in a very short period of time, why would we continue to move forward with reopening if we're seeing that large of a increase in cases?
Well, our position is that this is our first real test, this last outbreak, this mini outbreak that we've experienced. I think the first cases that we had in March and April, they were so few, they represented really just, the virus knocking at the door, basically, for the county. I think this last group of clusters of cases really represented the first time that we've seen some virus transmission in a more meaningful way and kind of a hint of what we should be starting to expect going forward. And the other thing about it is what Heather alluded to earlier. I mean, our nurses just did a fantastic job. I mean, they came in on weekends, every weekend day for the last not last weekend, because last weekend it quieted down, but the 2 weekends before that, they were there every day. And I know that because I was there every day. I didn't do that much. I was just supervising and answering questions, but we got on this and started making the calls and making the connections and connecting the dots and figuring out who needed to be tested. And I'd like to point out that, that total has jumped up quite a bit, but at least half of those cases were people we directed to go get tested because of their exposure risk. And sure enough, they turned out to be positive. So that's a measure of us doing contact tracing and doing it in the right way. And I actually think we did a pretty good job. It's hard to do it any faster in our system, but the places around the world where contact tracing has really paid off and worked well, they do it super fast. I mean, they get contact with everybody within 12 hours or less, pretty much consistently. And that's when it works the best. So we're trying to reach as close to that kind of goal as we can. And I think with this first burst of cases, I think we did it. I think we did pretty well. It's probably not over. I think there's still some transmission going on, probably at a lower level, because doing this contact tracing is designed to shut down the opportunity for the virus to move. And so it's probably not really over. It's just that it's been calmed down. And that's what we want to see. And it's really what we're going to be doing for the rest of the summer, I think.
So, Dr. Raywell, most of our community realizes that the 4th of July activities that we typically have been canceled. The Del Norte County Fair has been canceled. And so one of the questions that we have is, are we looking at all large gatherings just being canceled indefinitely? How are those guidelines going to work? You have any idea about how that's going to be relaxed and when?
I don't have a clear idea. I kind of been thinking that we will be in that last stage of the reopening sometime in the early fall. The hardest part is going to be actually opening schools, because schools are kind of the ultimate venue for moving viruses around. And everybody who's been a parent knows that. So, and anybody who's been a teacher knows that. So we're kind of anticipating that some of this might get put off until after schools open. I don't know the answer though. It's in the hands of people at the state level who are trying to look at the data with as much scrutiny as they can and decide what the timing is for those steps. I think it's going to be down the road a ways. And that's why I've been telling people it's probably better to not plan on those kind of mass gathering events rather than plan on them. We don't know. It's just, there's too many unknowns at this point.
Dr. Raywell, you mentioned kids and schools. One of the questions that we received had to do with playgrounds, and the idea being that if we were to open up playgrounds sooner, then there would be some levels of interaction with our children and that population, and possibly even move some of the virus through these children, prior to bringing them all back into a mass setting like school. And I just wonder what your thoughts are on that idea.
I thought it was a well thought out idea. I also know that the state level, they are looking at the question of when and how to open up child activities or activities for kids in a more concrete way. And that is pretty close. I think we're going to get some news about that in the next few weeks. I just don't know precisely when. And I think, it does raise a point, and especially because kids can't stay cooped up forever. It's got to be an outlet for everybody. And, for kids, we know that they just need to play. That's just part of normal growing up. So I think there's going to be a formula coming down the road pretty soon. We just don't have a timetable yet.
Do you think that when you look at outdoor activities like that, do you think that we're still going to be, our next question is going to be about masks, but do you think that that's going to include continued using of masks and some kind of at least modified types of social distancing outside?
I think for adults and for older kids, yes. We're still going to encourage that. Taking everything away is usually the mistake that we want to avoid. So if we know that that can help prevent some transmission, it can slow down transmission, it can make a difference. Yeah, we want to encourage that. It's hard to imagine that on kids, especially younger children. You know, I mean, it's just not realistic. But for older children and teenagers and adults, yeah, I think it's still a good plan.
Well, let's talk about masks again. It doesn't seem to matter how many times we say it or exactly how we say it. It seems that there's still some confusion out there. So I guess this is your shot at trying to once again educate us on what are the expectations when it comes to masks, and what should we each be doing right now today?
Yeah, my expectation is not to have 100% of Del Norte residents wearing a mask indoors 100% of the time. That's not going to happen, and nobody expects that. What we want to have people do is get as many people to wear a mask as often as they can indoors. And the reason is it's that indoor setting where you're going to have the biggest risk of infecting someone else. And the reason this is super important now is because we have learned, especially with this last burst of cases that we've been dealing with, that there are a lot of people who have no symptoms and they're still testing positive. So the whole notion of being asymptomatic without symptoms or pre-symptomatic, you're going to get sick, but you're in that window of a couple of days before you start having symptoms that you're positive and you can spread the virus. We've been hearing about this from the federal level and even at the state level. We're seeing it firsthand now for the first time in our county. And it really is true. And it makes a big difference. So one of the reasons wearing a mask helps is because you don't know if you don't know that you've been exposed, you don't know necessarily that you're pre-symptomatic and that you're about to get sick, but you're still spreading virus. And that's the key take home. That's why we say it's actually helping to protect other people more than it's protecting you. Yeah, it does protect individuals a little bit. It's not as good as wearing an N95, but it's better than nothing. But it's much better to protect the people around you because, you know, if you're breathing out those droplets that have that virus, and most of them, or at least some of them, are getting stuck on that mask, that's a prevention. That's reducing someone else's risk. So that's what we want to see. Now, I don't expect to see anything change instantly, but I have a feeling that over time, as the disease activity picks up, as we relax things, we're going to start seeing people end up in the hospital and maybe even see someone on a ventilator one of these days. And I think people will kind of pay attention at that point, and maybe the mask use will pick up at that point as well. And most important, it gives some teeth to the notion that a business owner who wants to protect their employees or protect their customers from someone not wearing a mask can say, hey, buddy, you can't come into my business without wearing a mask. And it puts a little bit of teeth behind that statement. And, you know, are we going to cite people for not wearing a mask? No, I don't think the sheriff has a plan for that. I don't think Chief Griffin has a plan for that. But if a business owner calls and says, you know, I'm worried about someone in my store who's not wearing a mask and he looks like he might be sick or something like that, that person could be cited for trespassing. So, I mean, there is potential consequence. I don't want to ever see that happen. I just want people to understand the need to do this and the importance of doing it. And I think over time, it'll start to sink in again. I think people did a really great job in March and April. And I think we kind of got a little bit too confident because we had so little activity going on. And we started to relax our guard. And that's what I've seen. And a lot of people have been talking about lately. Too many people not wearing masks, not quite doing the social distancing that they were doing. And that may be why we had this uptick in our cases in the last few weeks. And it might be as simple as that. So masking is important. I'm not going to stop preaching that. I'm going to say that till the very end. And I really hope people start to believe it again.
I was on a call with Senator McGuire this week, and one of the questions that I asked him was from a state level, what his thoughts were on lifting of the travel restrictions and the associated things that go with that, specifically the 30-day short-term rentals, RV parks. Any insight that you might be able to give on what you're hearing in regards to being able to see our short-term rentals open back up?
Like I said, I think there's been some movement at the state level about this, at least for campgrounds, maybe RV parks. I don't have a clear idea of what the schedule would be. I've been asked this a couple times. I think it'd be unusual to see anything change before next month. I personally would not want to change anything locally. You know, even if it was handed to us tomorrow, I would want to take a little time and say, we need to measure what we've just been doing, what we've just implemented. So I'd be very reluctant to make any changes before then. But I do know there's been some talk about this. And, you know, I've talked about this before and other people have brought it up that, you know, camping is by nature a socially distanced activity. And RV parks are, you know, RVs are pretty much self-contained. And there's some interaction and there's some people who share some space, but it's mostly outdoors. So, you know, it does make common sense to allow those things. We just haven't seen the schedule yet.
So yes, Jerry.
While you're on that subject, Dr. Raywalt, if I could just a little follow-up in there, you talked about a timeline. You wanted to see what kind of impacts we've got from what we just put in place. What is that timeline when you would start looking at something else? 2 weeks, 3 weeks, longer?
I'm thinking towards the end of this month. I haven't picked a precise date. Part of it's because some of the things that we've had recently have been allowed to be active again. They haven't been fully implemented. There are a lot of congregations that are not going to start their first service till mid-June. And so, you know, it's being spread out a little bit over about 2 or 3 weeks. And I think building a little extra time at the end of that makes more sense than making a decision too early.
Okay, thank you. I just wanted to get some.
Again, just sort of a follow-up from that then, Dr. Raywalt, your perspective then would be for RV park operators and so forth, they should not be trying to plan for anything before the 1st of July. They need to accept that this month is really probably not a realistic opportunity for them to look at any kind of reopening of short-term rentals.
Yeah, I'm sad to say it, but I think that's realistic to not expect anything in June.
Okay.
You know, if we get some different guidance and some encouragement at the state level, especially if it shows up by mid-June, you know, maybe potentially by the last week in June. But I'm not counting on anything like that. We're not planning on that yet. But, you know, we've made some quick changes on a lot of issues centered around this virus, literally from one day to the next. And it's been a moving target for everybody. So things can change. So we'll see what happens.
Okay. Let's turn our attention to testing, recoveries. I know that we've been very fortunate to have access to the mobile testing site by Verily. I did hear yesterday, however, that they weren't even close to hitting the max number of people that they could test in a day. So I certainly want to encourage our community to take advantage of this. Sign up. I know Jerry, you used the site this last week, and
I did. Yes.
Speak to that.
My wife and I both tested the first day that it opened, which was Friday, and they canceled Saturday. But my wife and I tested on Friday and got the results back on Monday. We both tested negative, you know, for the day. You know, I don't exactly know what that means, but you know, it was good to be part of that. I think that's important that as we move through this, that whether you feel well or not, you have the opportunity to get tested. So get out. It's not invasive. It's very simple. So if you get a chance, get tested, get online, make your appointment and do it.
Thank you, Jerry. So Dr. Raywalt, should people be tested for COVID-19 even if they don't have any symptoms?
Sure, if they want to.
Yeah. And
answer.
So what advice would you give to Chair Hemmingson now that he's been tested? Does he need to be tested again at some point in time? Is there, what's the guidance that you might give to somebody who tests and gets a negative test? Should we be tested regularly? What's your thoughts on that?
I guess it would depend on why you got tested. So let's just back up a little bit. If you were having some sort of suspicious symptom, and right now, you know, with a lot of flowers in bloom towards the tail end of spring, a lot of people have allergy symptoms this time of year. They can't really tell. They might be thinking, do I have a really mild case of COVID-19? That's good enough reason to get tested. just to be sure.
Sure.
If your symptoms are more like flu or more like COVID-19 and you really are concerned, you definitely should be tested, because if you're positive, it helps you plan what you need to do in your home. And it'll help when our team calls you and talks to you about, your contacts and who else you've been with and where you've been the last, however long you've been symptomatic. That's the process of contact tracing, because we want to get on top of that, find out who else you might have exposed and not knowing it. If you're just curious, there's enough reason to get tested. The problem with getting tested is it really only tells you what's going on that day. It doesn't tell you much about the past, and it doesn't predict anything about the future. It just tells you if you're positive that day and whether whatever you're experiencing could be from COVID-19 or not. So can you get retested? Yes, you can. Conceivably, you could get tested every 2 days on this testing scheme if you wanted to go in that often. I don't know if there's much utility in that, but we don't want to discourage people from getting tested for any reason, because we are, like I mentioned before, we are seeing cases of people coming in, being tested because we told them to, and not having any symptoms and turning out positive. Now, the flip side of that is that if you know that you've had COVID-19 and you go on getting tested over and over again, waiting for it to turn negative to prove that you're not infectious anymore, you might wait a long time. And the reason is that the research data that was done, this has been done in the last few months, but it's a pretty clear story. For the average person, most people stop having virus that is going to infect someone after about 10 days from the onset of their symptoms, especially if their symptoms have improved and they're not having fever anymore, because those are markers that your body's responding, your antibodies are kicking in, they're attacking the virus, and you're not going to infect people at that point. So that's really how we decide people have, quote, recovered, end quote. What it really means is we don't think they're infectious anymore because of the time it's been since they started having symptoms, the time it's been since they last had a fever, the time it's been since they started feeling better. And we just plot that out and say, we think that by such and such a date, you're good to go. They can still have a positive test though. And the reason is, as you recover, the virus is being coated with antibodies. It may not be it may not be being produced in complete fashion. So there is detectable genetic material of the virus when we do the test, but it's not something that's going to infect somebody. And this has been studied in the lab. I mean, they've done samples of people that far out, and they find it's not, the virus doesn't grow. It doesn't infect other cells. It's a marker that you had the virus, and it's like the virus has just kind of been hamstrung. It's not going to do anything or go anywhere or infect anybody, but it still make a test positive. So we actually are trying to steer people away from getting that second test to prove that they're negative, because a lot of times it can take weeks and weeks before that happens. And you're waiting a long time, getting frustrated, not really understanding because you feel fine, not really understanding why your test doesn't turn negative. And that's the downside of a PCR test. It's so sensitive, it can pick up that trace amount of virus as you clear it out of your body. That's not going to infect anybody, but it's still in your system. So there's a point where you shouldn't go in and get tested anymore. And usually after you've had COVID-19 and you think you've had it, it's better to just map it out in terms of the time when you start to feel better, when your fever goes away and stays away for 3 days. And then talk to us, talk to the health department, and we'll help you figure out when it's safe to go back out and do what you normally do.
What about antibody testing? We've talked about this before. What is there value to doing the antibody testing? And one of the questions that asked was, if you get the antibody testing and it shows that you have the antibodies, does that change how you should react to everything else? Does that mean you don't have to social distance anymore? Does that mean you can't get COVID-19 again if you have the antibodies? Could you give us some insight on that?
Let's do the last part first, because that's probably the most important. So we think that after you've recovered and you have high antibody levels in your system, you are protected for an immediate reinfection most of the time. And the reason is that because the antibodies are part and parcel of you recovering, we think they are what we call protective. So having protective antibodies is a good thing. It doesn't necessarily mean you're not going to get sick with COVID-19, but what it really means is that if it happens again, it's going to be very mild and you'll recover even faster. And the longer you go out from the infection, the the protection effect of the antibodies will start to diminish. And with other coronaviruses, we know that can last a year, maybe even longer sometimes. We don't know for sure with this virus how long that protection lasts. But we think that having had the infection and having had your immune system have to make antibodies, you retain the memory of those antibodies in your immune system. So the next time you get exposed, you'll fight it off faster. And that's the key thing. It's sort of like the flu vaccine. The flu vaccine that people take every year doesn't guarantee you're not going to get the flu. What it's really designed to do is keep you from getting a bad case of the flu because you've jump-started your immune system already. You've already programmed it to have those antibodies ready to fight it off when you get exposed. Sort of the same principle with this. As to the value of getting antibody testing, it's kind of nebulous right now, because at an individual level, it might answer a question about an infection that you were suspicious of, or maybe just measuring whether you have protection and you want to be sure that you have protection, even though you know you had COVID-19 and you recovered. For us in public health, it's going to serve greater utility in actually finding out how many people have been infected and recovered down the road a ways. But the problem is the testing is not very reliable yet. There hasn't been nearly enough time to study any of the tests that are out there. And so we know that some of them have a false positive and false negative rate that it makes it hard to use when we don't have a lot of disease activity going on. And I'll give you an example. Say we've had 4% of the population infected and recovered, but the test has a 5% false positive rate. That means that it's almost even chance that a positive test could mean that you were infected and recovered, or it's false positive because of the nature of the test. So it makes it very hard to use right now, because we're pretty early into this. But we actually do want to set up a time later on this summer when we're going to do a sample of the population and ask them to come in and get their blood drawn so we can actually do antibody testing and see where we really are. Because right now we're basing it on estimates based on the disease activity and other places in California that have already done some of this kind of testing. We won't really know for sure for a while. So down the road, it'll help us. On an individual basis, it might answer a question, but does it really matter to decide whether you've been infected or not? At this point, we can't say.
So how do we know when someone's recovered? What is the basis for identifying? We see this on our statistics, and we see it come up on the website where people are recovered. Is it assumed that after this window that we've been talking about, 10 to 14 days after a positive test, are we asking people to do any kind of antibody testing to show that they're recovered?
No, they're not doing that yet. What we're asking them to do is stay home, isolate, monitor their symptoms. We do a lot of follow-up calls. So, a lot of contact tracing is actually more than just the first time or the first 2 times. It's follow-up calls afterwards to make sure people are doing well. And then we ask them to monitor their temperature and monitor their symptoms. If they feel like they're getting better, like their cough is getting better, their energy level is getting better, the aches are going away, whatever the symptoms that they had are getting better, and their fever has stopped without using fever reducing medicines like Tylenol or ibuprofen. It's just stopped on its own, and it stayed that way for at least 3 days. And we basically say if those 2 conditions are met, and it's been at least 10 days or more since you started having symptoms, at that point, we consider you not infectious, and you are essentially on the road to recovery. So we categorize that person as recovered, because we know that they're not likely to have any further problems from it. Once in a great while, people can have a complication related to having had the COVID-19 infection. People can get a secondary pneumonia. They can get a different kind of pneumonia. They can have, we've heard some really horrible stories of how bad this can be for some people in the hospital. So calling everybody recovered on that basis is kind of using the word recovered incorrectly. For us, it means that we think that they're not infectious anymore and that they're on the road to recovery. And many of them are recovered at that point. They're feeling well, and they're well enough to go back to work. But we're really trying to decide, are they a risk to anybody else? And that's really our job, is to figure that out. And that's the formula that we're using, because that's the standard formula that's used pretty much around the country now. And it does work. So we have pretty good confidence that when we say someone is out of that window and they've done those things and their fever's been down long enough, they're good to go.
Just got a couple more questions, and we're going to open up and maybe take a few live questions. In regards to notifications, one of the questions that we got was about the responsibility. Who has the responsibility? If an employer, if a business that is open to the public knows that they have an employee that has tested positive, whose responsibility is it to communicate that to their customers? Is it the business owner's responsibility? Is it a public health responsibility? What is some words of advice that you can give about that kind of scenario?
It would depend on the nature of the contacts of that employee. So for some such situations, we would not consider it any kind of a risk. If it was, just brief encounters with the public for just a few seconds or perhaps a minute or less. If it's a kind of a business where that employee is face to face with someone, and especially in close distance, or not wearing a mask and in close distance, especially if it's gone on long enough. And we usually use the cutoff of 10 minutes. A lot of other people are using the cutoff of 15 minutes, but we're being a little more conservative. Then we would want to know about that customer, and we would want to do contact tracing on that customer. So our job is to reach out to people individually. It would largely be up to the business to decide if they wanted to give a more general announcement to their customers. And we encourage people to do that because we think it helps, in the long run, helps build trust, because people understand, hey, it's not their fault, it just happened, and they're watching out for me. We would not normally take that step unless there was some problem with us not being able to reach out to the people we thought we needed to reach out to individually. So there are scenarios where a health department might ask for, did anybody who was in business X on the day of, May 25th between the hours of whatever, please report to us. We have some questions for you. You try and keep it as anonymous and innocuous as possible so that people aren't alarmed and people don't take any kind of retaliation against anybody. We don't want to see anything like that. But for us, the key thing is finding out those individuals that we think might have had a true exposure and reaching out to them and finding out what's going on with them, and then perhaps directing them to get tested. So, that's our part of this. The business owner, it's up to them to decide how they want to proceed. A lot of businesses have built into their plans that if they have an event where an employee turns positive, they're going to actually shut down for a couple of days and do deep cleaning and talk to us and do contact tracing. So I think when that happens, it's sort of self-evident that something is going on. And we really think it's important for them to say, yeah, we had an employee who was positive and we're working with the health department to correct it. Because that's really what should happen, and that's what we'd like to see happen.
Anything else that you think would be helpful just for the community here about monitoring or enforcement? Anything that maybe that we just need to clear up? I know you've touched on it in several different ways tonight, but is there anything else that you can think of that would be helpful? Well, enforcement is hard for public health because we don't carry a badge. We depend on the need and the efforts of other people within the city and the county to help us do what we're supposed to do. I think one of the biggest issues that has recently come up was the news about some of the hotels booking. We had pretty good evidence that some of the hotels were booking people who probably shouldn't have stayed. And I think there's been some hard feelings about that, and rightfully so, especially from the other owners of rental businesses of any kind who've been doing it right. They've been towing the line. So we're going to be watching that a little bit more closely. In fact, we're going to watch it a lot more closely because it's part of the state plan not to do that prematurely. But it's hard. It's not something that you can do in one step and make a huge difference. The same is with masking. It's hard for us to see going out and enforcing a masking order on everybody who doesn't wear a mask every day. There are plenty of people who probably shouldn't wear a mask because they may have genuine trouble breathing if they have chronic lung disease or they have anxiety disorders. I mean, it can be a very difficult thing to wear a mask. Those people shouldn't. And how do you distinguish the average person on the street from someone who just doesn't want to wear a mask versus someone who shouldn't wear a mask? That's really hard to do. So that kind of enforcement probably not going to happen. And a lot of public health
is really dependent on people believing that the importance of what we're telling them. So that's why we keep trying to get the message across, the importance of doing this, because enforcement for us is tough. It's a challenge.
Thank you. We're gonna turn and maybe take a few, we've got 10 minutes or so, maybe of some questions from those who are joining us here on Zoom. So just like it would be if you were joining the city or the county for one of their meetings, if you would like to ask a question, something that maybe has not been addressed tonight, I'd ask you to click that raise hand button, and then our host will identify you and will allow you to ask your question. All right, I see Mr. Barnes has his hand up. If we could activate him and let him ask his question, please.
Thomas Barnes, do you hear me?
We can just barely hear you, Mr. Barnes.
Wow, okay. Is that any better at all?
That is better. Yes, sir.
Okay. My question is, I have two. Thank you for taking my questions. Dr. Raywald, if somebody is hospitalized in this county, what treatments are available to them for treatment? For instance, do we use or allow the use of hydroxychloroquine in this county?
Well, that would be a decision by their care provider. Some people have been using hydroxychloroquine experimentally, so to speak, on an individual basis, because there was some data that fairly early on that suggested it might help. There was a pretty big study just published this week, though, that has pretty much showed that the benefit is pretty small if it's even there, maybe on the order of 2 to 4%. And hydroxychloroquine is, especially if you have to use a lot of it for a long time, has some very significant potential side effects. But that's still an individual decision. It's not been banned in any way for off-label use. Essentially, it'd be what we call off-label use for this particular disorder. So it'd be up to the individual.
Okay, Mr. Barnes, you said you had another question?
One other question. Can you hear me now?
Yep.
I'm not sure. Do I understand this correctly that if someone travels outside of Curry County, Josephine County, or Humboldt County from this county, and then they return, is there a requirement that they self-quarantine for 14 days?
It's not a blanket requirement. What we're asking people to do is consult the CDC website. There is a monograph about this that describes the risk of traveling and returning. And we're asking them to kind of decide on their own if they should quarantine or not. And it's just to protect them and their own family, anyone else they might be in contact with. This has come up a couple times during this whole epidemic, and we've treated every case individually. So at one point, we had considered putting in a blanket requirement, but the whole pandemic, the nature of it has changed so much, and generally we feel that everything pretty much in the surrounding area is community spread. We just want to remind people that depending on where they went, who they were with, and what they experienced when they were outside of the immediate counties, we really want to focus on, should I stay home? Just ask themselves that question. And the guidance document kind of walks people through the basic things they should think about.
Jerry, did you have a thought on that?
Well, yeah, not so much on that, but I got to thinking that this might come up in subsequent questions. There's a lot of it that is not really laid out on what businesses that can open, but there is a list of businesses that cannot open in the state of California at this time. And I could read that list real quickly. The following sectors, businesses, establishment, or activities are not permitted to operate in the state of California at this time. That is personal service, such as nail salons, tattoo parlors, gyms, and fitness studios. indoor museums, kids museums, gallery spaces, zoos and libraries, community centers, including public pools, playgrounds, and picnic areas, entertainment venues such as movie theaters, gaming, gambling, arcade venues, pro sports, hospitality services such as bars, wineries, tasting rooms, and lounges, nightclubs, concert venues, live audience sports, festivals, theme parks, hotels, lodging for leisure and tourism, all non-essential travel, higher education. I just wanted to get that out there because that's specific. That's telling you exactly what businesses are not allowed to open in the state of California.
Thanks, Jerry. All right. We have any other questions from our public that is joining us? If you do, if you would please hit the raise hand button and we will we'll activate your mic. Give you a couple minutes, and if we don't have any, we'll see if we have any final closing thoughts from any of our panelists tonight. Yes, Ms. Suzuki is there. If we could activate her mic, she has a question.
Hi, can you hear me?
We can.
I was just curious, should people like keep a log of their daily activities in case they do have to go back and do contact tracing later on if they are found positive?
Great if people would do that. We kind of think that's asking almost too much, but if people want to, that would be the best thing ever, because that would really help us. And when we reach out to people, the first thing we say is, can you check your transaction log for your credit card, or look at your calendar, check your schedules, talk to whoever is with you, kind of go backward in time and try and be as thorough as you can about where you've been, who you were with, how long you were there, and the circumstances. Yeah, if you want to write it down as a log, that'd be wonderful.
Thank you.
Yeah, my daughter who's in South Korea, well, they had to all download that app that kept track of them because otherwise they immediately get fined. But she said, that was the way they monitored people over there. And I know for us, it's an invasion of our privacy and all that. But I mean, it's a simple thing to jot down where, like if you went to the market or if you went to the school or this, that, and the other. I mean, that's what I've been doing because I'm an essential worker and I need to keep track of where I've been, because if I should test positive, then I've got to, let people know that.
Yeah, it's a great idea. And if people want to do it, all the power to them. It would help us immensely when the time comes if you got sick. Absolutely.
Thank you. Very good idea. Appreciate that. Okay, we have another question. Ellen, we're going to open up your mic. Can you hear us?
Yes, I can.
We can hear you.
I just was wondering, no one has ever mentioned the senior center, and I was just kind of wondering when that's going to be on the drawing board, or if it's still a long time in the future.
About when it gets back to normal?
In the future. It's never
In the
going to be
future.
the same normal.
That's a tough one. I mean, we were over at the senior center very early on in this outbreak, talking to the staff and trying to figure out what their plan was going to be. Because yeah, it's shared space with people who are pretty vulnerable, and very important to do things differently right now. I don't know the answer. I really wish I could mark out on a calendar with the day and time when things go back to the way they were, but nobody knows that right now.
Okay. Have any other questions? Hit that raise hand button if you do.
Yeah, Blake,
Yes.
while we're waiting for someone to raise their hand, I was thinking about that, the lady that talked about logging all of her activities. And I thought one of the reasons that I would get tested was if I did test negative at that point, and then somewhere down the road, I did test positive, I would only have to go back to that point where I tested negative to remember, who I contacted and who I was with. So that was one of the reasons I thought it might be a good idea just to get tested.
And the other point about the testing is that there should be no cost to the individual. They may take your insurance information down, but even if you have no insurance, there shouldn't be a fee. So don't let any cost concerns keep you away from the testing site, because it should be pretty smooth and pretty easy.
Good point.
Ellen, did you have another question? I see your hand still up.
Yes, I did.
Okay, go ahead, please.
Well, I just am a little confused. I do a lot of walking around town, and that hotel lodge down by the lighthouse appeared this weekend to have quite a few people, and they have condiments and napkins and stuff on the table. And I thought those were all things that were not supposed to happen. I'm just wondering why it appears that it's happening down there.
Well, condiments usually most people are taking condiment containers off of tables. Sometimes they're just wiping them down frequently. It kind of depends on individual choice of how people want to do that. It could have been, if it was a private individual, they just brought their own stuff to have a picnic. That might have been an explanation. I don't know, but it's not entirely unheard of for those kinds of things to still be in a restaurant setting. It's just that a lot of people have really gotten away from using that because it's just too hard to keep track of and keep it clean between customers.
Okay, thank you. All right, any other questions? We're going to try to wrap this up here in just a minute or two. But I'm going to give you any final chances. Gary, any final words that you'd like to share this evening?
No, I think it's all good. Thanks for putting this all together. I know you put a lot of hard work into it. Thanks, Richard, for being on, and Heather, and all your staffs and all the staffs of the county. The counties and the city staffs are there to assist you, and as well as public health and the health department. So if you do have some concerns, ask for assistance, give a call. That's it.
All right. Dr. Raywald, I want to thank you again for taking the time. I know how busy this has been for you and for all of your staff, but I have been committed since the very beginning of this to making sure that we do the best that we can to provide good, timely communication. And I just want to let you know how much I appreciate your willingness to do this. It is an invaluable resource to our community to try to answer their questions, as well as just give them the information that they need. So personally, I just want you to know how much I appreciate that, and the time and all the efforts that you and your team have put into this.
Thank you very much, Mayor. It's a good opportunity. I'm glad to participate. I think it's important to get the message out there. So I'll keep coming back.
All right. With that in mind, I thank you everyone for joining us tonight. We will continue to do this on a regular basis, and especially as we see any changes, when we see the major changes that come down from the state level, or we make significant changes to our approach here, we will be here in front of you, allowing you to ask your questions and provide you the very best answers that we can. And with that, please stay safe, stay healthy. Remember what Chair Hemmingson shared with us a while ago. Your first responsibility is to show your respect and care for others. So when it comes to wearing that mask, remember that really it's about you showing respect and care for your fellow man. And I think that that's always the approach that we should in thinking about others first. With that, good night, everyone. Thank you for joining us.
Good night.